Okay, in an effort to visualize our leveling concept for physicians at 98.6, my son Drew and I created this railroad track. I will explain it and hopefully it will help us all visualize the different tracks that we can be on in our career progression here. So here is a physician, a little train that is applying for a job at 98.6, whether it's for a clinical position, a leadership position, or a product physician job. We have certain ACGME competencies, 5 years of experience, core values, other things for the job that are required. So then this little train starts chugging along in the hiring and contracting and credentialing process. Once we get across that bridge and get hired and we're all set, we move into the onboarding and licensing and training, considered level 0. Once we get through all those stages and the competencies associated there, we move into the full-time transition station. And there's 2 different directions. So this is our physicians in an IC level 1. Could also be a product physician, IC level 1. But essentially, there are 3 different directions that folks can go out of the full-time transition station. So if you were to take this pathway, those that are hired as core physicians, we will complete our 51 licenses, different competencies, behaviors, revealing different values that are consistent with the company. Pick all that up, and we start moving along into the core physician IC level 2. And we're consistently practicing in the clinic at this point, and we move on through. Now, once we get to these other loops, you can see this is the clinic loop, and this is going to be your individual contributors, your physicians moving through their clinic experience. So as we move up, we go up some hills, we achieve some new competencies, and we can level up to a level 3. We keep moving along our track. And these tracks do not represent certain time. It is all based on competencies, which we will have laid out in our charts. But we go up some hills, develop some new competencies, and we transition to this level 4, an individual contributor core physician. Keep moving along. And the highest level, at least in the core physician pathway, is this principal level, a level 5. And so when you get to that level 5, you can kind of move on and function as a mentor, and you can see those sorts of things. It doesn't mean that that person is always going to be in that pathway. As you can see, there's different transition points that are possible here. So once you get to the level 5, theoretically, if they have those competencies, they could actually move on over here to the director, the people levels and the vertical level 5s. But that would be competency based. So, okay, and finally, let's talk about our transitions into a people pathway or a vertical leadership pathway for our clinical physicians. So if we have our clinical physicians that come in, get all of the onboarding, licensing, training, move through our core physician level 1, getting all of the licensing and full-time transition status done. We have all these competencies, behaviors, and values that we're revealing. They move into this core physician level 2 and are functioning in the clinic. After a period of time, we've sort of said 6 months, but again, time is not necessarily the deciding factor always. Perhaps this train goes this way on the pathway. We still are functioning clinically, but we move up into these either level 3 medical director, assistant medical director, vertical work, or associate medical director, which is the people work, again in a level 3. And those may have adjustments to FTEs, but they might not. So it's based on sort of the work that is required for those positions. And then they move into this other loop option, again continuing to practice clinically, at an FTE determined by the workload. They move on through into a level 4 after some time and experience and development of additional competencies. So a vertical, just plain medical director, level 4, and an associate medical director lead, level 4. Again, people and vertical. So if you're responsible for people or you're responsible for projects and guidance of the areas, I've got Lauren's team, the vertical dyads. So again, that group of people, as they develop new competencies, keep moving forward, get to this, senior associate medical director, which is a people level 5, and a senior medical director level 5 as well. And then those folks could again move on forward into the VP level and or CMO as they keep moving forward. Okay, coming back to our full-time transition station, you can see that there is a pathway that moves us into kind of the leadership pathway right off the bat. If that, it would rarely occur that we might hire someone in a leadership position and they can kind of move through the levels, through that pathway. But after completing all of these other sorts of things, the product physicians also would transition here. So they have a set of competencies, behaviors, and core values that they would, have to show as they move into their different levels. And the train for the product physicians then, moving into product physician level 2 as a starting point, and then moving on through their pathway to the assistant director product physician level 3. And again, you can see that in the physician groupings, the level 3s are, all equals. Keep on moving through some competency development to a level 4 director product physician. And then, maybe they continue on in their pathway through level 5 and keep moving around in the product physician role as a senior director product physician. Again, these loops don't represent time per se, but just, a point of arrival. The product physician and clinical side in terms of a level 6 meet up over here. And then you can see our CMO over there, level 7. So this is the product physician lane. And finally, here's just kind of the overview of our tracks. And again, the objectives of leveling are to give folks a concept of targets, to create positions that are possibly interchangeable, but again, based on competencies and behaviors that are revealed in order for folks to move up in those levels, and to create a system that's consistent with the culture of our tech colleagues who have similar structure. Hopefully this helps.